Imagine your body as a wise old friend, gently nudging you with whispers of caution. These whispers are subtle, often mistaken for everyday ailments, but they are crucial signals your heart sends out before a potential crisis. Recognizing these signs can be the key to prevention and peace of mind. 77% of senior heart attacks show early warnings for weeks, but most ignore sign number 3 until it's too late. And today, I'll show you how to spot these life-saving clues. Welcome to Elderly Active Life, your trusted companion in navigating the golden years with vitality and awareness. We are dedicated to bringing you daily insights tailored specifically for seniors, focusing on health, wellness, and active living. Before we delve into these vital signs, ensure you like this video and subscribe to our channel. By doing so, you join a community committed to staying informed and proactive about senior health. Remember, we upload videos daily, exclusively for seniors, right here on Elderly Active Life. Now let's explore these 7 critical whispers your body might send in the weeks leading up to a potential heart event. Pay close attention, as early recognition is your greatest ally. Sign number 1, unusual fatigue. The first sign is unusual fatigue. This isn't just feeling tired after a busy day or a poor night's sleep. This is a profound, persistent exhaustion that feels different, deeper, and doesn't lift significantly with rest. You might find simple tasks, making the bed, preparing a meal, even taking a shower, suddenly feel like monumental efforts, leaving you drained. This fatigue often creeps in gradually over weeks. Why does this happen? When your heart muscle is struggling due to reduced blood flow, often from narrowed coronary arteries, it becomes less efficient at pumping oxygen-rich blood throughout your body. Your muscles and organs, starved of this vital oxygen and fuel, simply can't function optimally, leading to this overwhelming sense of weariness. Think of it like an engine sputtering because it's not getting enough fuel. Crucially, this fatigue may be more noticeable in women. It's essential to listen to this signal, especially if it's new, unexplained, or significantly worse than your usual baseline. Don't dismiss it as just getting older. If this profound tiredness persists for days, interferes with your normal activities, or is accompanied by other symptoms like shortness of breath or a sense of dread, it's time for a conversation with your doctor. Track when it happens and what makes it better or worse. This fatigue is your body's early alarm bell that your heart is under stress and working harder than it should be. Sign number 2, shortness of breath. Closely linked to fatigue is the second sign. Shortness of breath, medically known as dyspnea. This isn't just being winded after climbing stairs, which might be normal for your fitness level. This is feeling breathless doing activities that never bothered you before. Walking across the room, getting dressed, or even sitting still. You might find yourself gasping for air unexpectedly. A particularly telling sign is shortness of breath that worsens when you lie down flat, often forcing you to prop yourself up with pillows to sleep, orthopnea, or waking you up gasping in the middle of the night, paroxysmal nocturnal dyspnea. What's happening? When the heart is weakened or its pumping efficiency drops, often due to underlying coronary artery disease or heart failure, blood can back up into the lungs. Fluid then leaks from the congested blood vessels into the lung tissue itself. This fluid creates a barrier, making it difficult for oxygen to pass from the air you breathe into your bloodstream. It's like trying to breathe through a wet sponge. Your body responds by making you breathe faster and harder to try and get enough oxygen, creating that distressing sensation of breathlessness. This symptom can sometimes precede chest pain and is another critical warning sign, particularly if it's new, progressive, or occurs at rest. Pay attention if you notice you need to pause more frequently during activities to catch your breath, or if simple conversations leave you feeling winded. Don't assume it's just age or being out of shape. Unexplained shortness of breath warrants a prompt medical evaluation to determine if your heart is the source. Now we want to hear from you. How old are you? Drop your age in the comments below. We love knowing who we're talking to and how we can better serve you. Whether you're in your 60s, 70s, 80s, or even 90s, your story matters here. Sign number 3, chest discomfort. The third sign is perhaps the most well-known, but it's crucial to understand its nuances. Chest discomfort. Forget the Hollywood depiction of someone dramatically clutching their chest in blinding pain. While that can happen, heart attack warnings are often much subtler, especially in the early stages or in seniors and women. This discomfort is often described as a pressure, squeezing, fullness, heaviness, or tightness in the center or left side of the chest. It might feel like an elephant sitting on your chest or a tight band constricting it. Crucially, it may not be sharp or stabbing. The discomfort can come and go, lasting several minutes at a time, or it might be more persistent. A key characteristic is that it can radiate, travel to other areas like your left arm, most common, but also your right arm, shoulders, neck, jaw, teeth, or even your upper back or abdomen. Sometimes the discomfort in these radiating areas is more prominent than the chest feeling itself. This happens because the nerves serving the heart also serve these other areas, and the brain can get confused about the pain's origin, referred pain. This is perhaps the most critical sign to act upon immediately. While not all chest discomfort is a heart attack, any new unexplained chest pressure, squeezing, or heaviness, especially if it radiates or is accompanied by shortness of breath, nausea, sweating, or dizziness, demands urgent medical attention. Do not wait. Call emergency services. Minutes matter. Remember, seniors are more likely to experience silent heart attacks with minimal or atypical pain, making awareness of the other signs on this list even more vital. Don't talk yourself out of seeking help. It's always better to be safe. Sign number 4, sleep disturbances. The fourth warning sign involves sleep disturbances. While occasional sleep trouble is common, a significant, unexplained change in your sleep patterns in the weeks preceding a heart event can be a red flag. You might experience persistent insomnia, difficulty falling asleep or staying asleep, waking up frequently throughout the night and struggling to get back to sleep. Alternatively, you might feel excessively sleepy during the day despite spending adequate time in bed. Why the link? There's a complex interplay between heart health and sleep. Underlying heart issues, like early heart failure or reduced blood flow, can cause subtle discomfort, shortness of breath, especially when lying down, or general malaise that disrupts sleep. Furthermore, specific sleep disorders strongly linked to heart risk, particularly obstructive sleep apnea, OSA, become critically important. OSA causes repeated pauses in breathing during sleep, leading to oxygen drops, surges in blood pressure, and significant strain on the heart. Loud snoring, witnessed pauses in breathing, and waking up gasping are classic signs. Even without full-blown OSA, poor sleep quality increases inflammation and stress hormones, worsening blood pressure and insulin resistance, all risk factors for heart disease. Poor sleep can also be a symptom of anxiety or depression, which themselves are linked to higher heart attack risk. If you notice a sudden deterioration in your sleep, needing more pillows to breathe comfortably, frequent nighttime urination, nocturia, which can also relate to heart function, unexplained restlessness, or overwhelming daytime fatigue despite sleep, don't ignore it. Discuss these changes with your doctor. Prioritizing good sleep hygiene and getting evaluated for sleep apnea are crucial steps in protecting your heart. Sign number 5, indigestion or nausea. The fifth sign can be particularly tricky, indigestion or nausea. Persistent, unexplained stomach upset, heartburn, a feeling of fullness or bloating after small meals, or waves of nausea, even vomiting, can sometimes be your body's way of signaling heart distress, especially if it's unusual for you or resistant to typical remedies. This happens because the nerves serving the lower part of the heart, the inferior wall, are close to nerves serving the stomach and diaphragm. When the heart muscle in this area is starved of oxygen, the pain signals can get misinterpreted by the brain as coming from the digestive system. It's a form of referred pain, similar to the arm or jaw pain we discussed earlier. This is why heart attacks are sometimes mistaken for severe indigestion or a stomach bug, leading to dangerous delays in seeking care. Key things to watch for: indigestion or nausea that feels different from your usual episodes, that comes on with exertion or stress rather than after specific foods, that is accompanied by other symptoms like sweating, shortness of breath, unusual fatigue, or dizziness, or that simply doesn't respond to antacids or typical stomach remedies. This gastrointestinal presentation is more common in women and seniors. The crucial takeaway? If you have unexplained, persistent indigestion or nausea, especially alongside any other symptom on this list, or if it feels profoundly different or concerning, do not assume it's just a stomach issue. Err on the side of caution and get it checked out promptly by a medical professional. It could be your heart sending a distress signal from an unexpected location. Sign number 6, swelling in lower extremities. The 6th warning sign involves swelling in the lower extremities, your legs, ankles, and feet. This swelling, known as edema, often manifests as a feeling of tightness in your shoes or socks, visible puffiness, or skin that retains a dimple when pressed gently, pitting edema. While some swelling can occur after long periods of sitting or standing, or due to certain medications like calcium channel blockers, new, persistent, or worsening swelling warrants attention. How does this relate to the heart? When the heart's pumping power weakens, a sign of heart failure, often stemming from underlying coronary artery disease, it struggles to effectively circulate blood back from the lower body. This causes blood to pool in the veins of the legs and feet. Increased pressure in these veins forces fluid out into the surrounding tissues, leading to swelling. Additionally, reduced blood flow to the kidneys signals them to retain more salt and water, further contributing to fluid buildup. This swelling is often worse at the end of the day and may improve somewhat with elevation overnight. It's usually symmetrical, affecting both legs. While other causes like kidney or liver problems or venous insufficiency exist, new or worsening edema, especially if accompanied by weight gain from fluid retention, shortness of breath, especially when lying down, or increased fatigue, strongly point towards the heart struggling. Monitoring your weight daily can help detect fluid retention early. If you notice persistent swelling that doesn't resolve with simple measures like elevation, or if it's rapidly increasing, it's essential to see your doctor to investigate the cause, which could very well be related to your heart function. Sign number 7, irregular heartbeat. The 7th and final sign we'll cover is an irregular heartbeat, known as arrhythmia. This can feel like your heart is fluttering, palpitations, racing, tachycardia, pounding unusually hard, skipping beats, or beating too slowly, bradycardia. You might feel these sensations in your chest, throat, or neck. While occasional harmless palpitations, like after caffeine or a fright, are common, new, frequent, prolonged, or symptomatic irregular heartbeats can be a significant warning sign. Why? Underlying heart disease, particularly coronary artery disease, which reduces blood flow to the heart muscle, can damage the heart's electrical system. This system controls the precise timing and coordination of each heartbeat. Damage or stress can lead to erratic electrical signals, causing arrhythmias like atrial fibrillation, AFib, premature ventricular contractions, PVCs, or ventricular tachycardia. Some arrhythmias themselves increase the risk of blood clots forming in the heart, which can lead to a stroke. Others, like ventricular tachycardia or fibrillation, can be life-threatening immediately. Arrhythmias can also reduce the heart's pumping efficiency, leading to symptoms like fatigue, dizziness, lightheadedness, or shortness of breath, linking back to earlier signs. It's crucial to note when and how the irregularity occurs. Does it happen at rest or with activity? Does it last seconds or minutes? Are you lightheaded or short of breath when it happens? While factors like caffeine, alcohol, stress, dehydration, or certain medications can trigger palpitations, new, persistent, or concerning irregularities, especially accompanied by other symptoms like chest discomfort, significant dizziness, or fainting, syncope, require urgent medical evaluation. Your doctor may recommend tests like an ECG or a Holter monitor. Don't dismiss persistent fluttering or racing. It could be your heart's electrical system signaling distress. Remember, friends, your body speaks to you. These 7 signs, unusual fatigue, shortness of breath, chest discomfort, sleep disturbances, indigestion or nausea, swelling in lower extremities, and irregular heartbeat, are its whispers of caution, especially in the weeks leading up to a potential heart event. Recognizing them early empowers you to take action. Never ignore persistent or new symptoms. If you experience any of these, especially chest discomfort or severe shortness of breath, seek immediate medical attention. For less acute but persistent symptoms, schedule a prompt checkup with your doctor. Describe your symptoms clearly, including when they started, how often they occur, and what makes them better or worse. Prevention is always the best medicine. Manage known risk factors, control high blood pressure and cholesterol, manage diabetes, quit smoking, maintain a heart-healthy diet, engage in regular safe exercise as approved by your doctor, manage stress, and get quality sleep. Knowledge and proactive care are your strongest shields. Thank you for spending time with us today. If this video helped you understand your heart's warning signs, please give it a thumbs up. Share it with friends and family. Awareness saves lives. Subscribe to Elderly Active Life and hit the notification bell so you never miss our daily videos packed with essential health tips, wellness strategies, and inspiration for vibrant senior living. Your health journey matters. Stay informed, stay proactive, and stay tuned. This is Elderly Active Life, signing off until next time. Take good care of your heart. It's the only one you've got.